And welcome back. Well, do you have insurance through the Affordable Care Act, or as some call it, Obamacare? If so, there are some very important things that you need to know before it's too late. This is decision-making time because open enrollment ends in 2 weeks on December 15th.
That's right. Mark Rakowski and Deanielle Coterel are here with Children's Community Health Plan with more, because now is the time to review your plan, make some decisions, and review everything, which is great. So thanks both of you for being here. Let's talk about the important things that people who have health insurance already through the marketplace, what they need to know now and what they need to be thinking about.
Sure. I think there's really three important messages that we're trying to get out, right? So the first one is that the Affordable Care Act is alive and well. There's been talk of repeal and replace and fix and change, and since the Affordable Care Act rolled out, but it is alive and well. There's a number of plan options available through the marketplace. The second piece is that, as you already mentioned, open enrollment goes until December 15th, so less than 2 weeks to enroll. And then the third message is that there's help available. So together with CCHP, which we'll talk about, we have licensed sales agents, and there's help in the community to help navigate people through this process.
Yeah, talk about then what Together with CCHP is.
Sure.
Together with CCHP is a health insurance plan owned by Children's Hospital of Wisconsin. We've been in business 12, 13 years. We cover almost 160,000 people in eastern Wisconsin. This is our fourth year on the marketplace, and we're looking forward to a pretty stable open enrollment. I think there's been a lot of turbulence over the first couple of years of the Affordable Care Act. Things have really stabilized. We actually have more choices in southeastern Wisconsin for individuals now than we've had in the past, and premiums in some cases have actually been reduced.
That's wonderful. Why do you think that people should consider the Together with CCHP?
Sure. Together with CCHP is affiliated with Children's Hospital, so we share the same values of providing care and coverage into the community. We're locally based, so it's really important for us to be here in the communities that we serve. And we're also really focused on having the healthiest members in Wisconsin. So we offer wellness incentives. We encourage healthy behaviors. We actually give people rewards for going to their primary care visits, to get their flu shot, and to sign up for a wellness portal. So there's a lot of other added bonuses for choosing our health insurance product.
Yeah, and with some of those wellness, you also have access to an on-call, which is 24/7, no-cost nurse line too.
Yep.
And I think people like having those sorts of wellness opportunities within their health care. How do people review the plans? What do they do in terms of like looking, okay, this is what I need, does it match up to my needs?
You can go to our website and look at all of the plan options we have. There are varying levels of deductibles, there's varying copays. I think you need to go much deeper than the premium. That's kind of the sticker price. You need to look at what the out-of-pocket costs are, and I think one of the most important things is the breadth and depth of the provider network. There are some narrow networks out there that could put individuals in a situation where they're looking at care out of network. We probably have about 70% of the providers in southeastern Wisconsin in our network, so that's really important to check. Is your doctor in the network, your spouse, your kids, whoever is covered by the plan? You want to make sure you have access to primary care and specialty care.
Yeah, because you never know either when that specialty care might be needed. As you review plans, it's something that may happen once you get into the year, not that you necessarily know it during open enrollment. I think the fact that you can enroll for coverage on healthcare.gov, as you mentioned, that it makes it so easy for people to take their time to review it, and makes it so convenient to be able to access that from home.
Definitely. Yeah, there's a number of ways that people can enroll. They can go right to healthcare.gov and look at all their options. They can come directly to our website and look at our plan options. They can call, they can get connected with a broker, they can get connected to our staff. All of the help out there is no cost to members too. So it's really important that members know that there's help out there. It may be confusing, but we can help at no cost to you.
And with the Children's Community Health, is it that you're going to a children's hospital, or are you going to other hospitals as well?
No, we've got a broad network of providers in southeastern Wisconsin, major health systems. While Children's is in our name, we cover the entire family. And I think, as Deanielle touched on it, we're local. We've got that Children's reputation and brand, and that I think people trust. So it's really important for people to look at their options and I think go with someone who is in the community and who's going to stay in the community.
It's a great point.
It works for individuals too.
Absolutely.
Yep.
Thank you both so much. It's wonderful, full time. You got to do it before next week, Saturday. So to review plans and enroll, you need to either call this toll-free number or check out togethercchp.org. So again, Affordable Care, this act, the open enrollment ends December 15th. Make sure you do that now. Visit the website or give that toll-free number a call. Great to see both of you.
Thank you so
Thank you
much.
very much.